Whenever we start the histology, it is better that we have a rough idea about the anatomy. You all people will be knowing better than me about the vein, artery, and nerve at the hilum of the kidney. And you find that these branch and rebranch to create the arcuate blood vessels. Externally, the kidney is being covered by the capsule and distinguished into the cortex and medulla. And these rays are the pyramids. In between them, you have got the secondary or the tertiary calyces. These all unite to form a primary calyx and ultimately drain through the renal pelvis. This alone we shall have in mind. Now, in this class, I shall talk mainly about the glomerulus. Now, once again, I am repeating it. This is the cortex over here, the darker area, and then there is a paler medulla, and then you have got the radiating pelvic ileal system, and then the renal pelvis over here. This we shall have in mind thanks to Anatomy and Histology by Bio 2002. And this is exactly what I want. You people should be familiar with it in order to explain to your students and also to understand the nuances of the renal pathology. Now forget the capsule that is there externally. I am finding multiple round structures, namely the glomeruli. In fact, an adequacy of a biopsy is determined by the minimum of 8 glomeruli, and that has to be represented. Nevertheless, and these are being separated by many tubular structures which are close. My professor used to call them back to back in arrangement. This can be disturbed in some conditions. So, the glomerulus and the renal tubules. And what is the glomerulus as such? I am taking this over here. So it is basically defined as a tuft of capillaries, and the ultimate function of it is filtration. So let us see what is over here. These are all a tuft of capillaries. I do not know the cellular detail of it, but then I am able to see that there is externally a glomerular basement membrane, and then there is a capsule that is surrounding it. Okay, and this is again probably the entry of the arteriole. This is a little more clear. I am able to see the afferent arteriole and the efferent blood vessel. Also, in the external, I am able to see a clear space, that is the Bowman space. Some books call them as a capillary space. And there is a capsule that is surrounding it, which is called the Bowman's capsule. These, of course, are the tubules. We shall come to them at a later date. And this is a highly cellular region, namely the glomerulus. This again is being repeated for your benefit. Kindly go through it. The cortex, medulla, pyramids, calyces, and the blood vessels and nerve. This is a slide of paramount importance. This, in fact, defines everything which you people can use for any apps. So in this case, I am finding that there is an arteriole over here, the efferent arteriole again coming in, and this is something like a pincer that is surrounding it, namely the glomerulus, which is again a tuft of capillaries. When I say glomerulus, a glomerular capillary, you find any capillary will be having an endothelium. Endothelium is the inner lining. But this capillary strangely has an epithelium also. So this is an epithelium. These are all the foot processes, and this is a more flattened endothelium, and this is a capillary space. Anything has to be supported, and this is the mesangium which supports the tuft of capillaries, and there will also be a matrix, the mesangial matrix. So mesangial cells, mesangial matrix, capillaries, endothelium, epithelium. Now, my job is not over. This is the Bowman space or the urinary space. And here again, you find that it is lined by another layer of cells, which is called the parietal epithelial cells. This is also epithelium, this is also epithelium. So, this we should know. And ultimately, it is draining into a tubule. There are different parts of it we shall be seeing, the ducts. The podocytes I have explained. Kindly go through this particular slide repeatedly, it is worth. And this is the structure of a nephron. And look at it over here. These are the glomeruli, and you find that these are all the tubules, and they are back to back in arrangement. The different forms are there. Some are elongated, some are more circular, lined by different types of epithelium. We shall come to it thanks to NUS, the National University of Singapore. And microscopically or electron microscopically, this is what we see. So this is the RBCs, which is the capillary, and there is the endothelium. Externally, this is an epithelial cell that is over there. And what happens to the food process, etc., we are supposed to find out. The stroma that supports is a mesangial matrix. Courtesy Anthony Chang. Next class, we shall see the renal tubule.